Okay, so thanks very much, David and Nikki. You're doing great work on the Sugar Road, and I guess looking at sort of large-scale sort of social movement that David's ignited in Australia and Nikki's leading in New Zealand. This is one thing that hits me on the sugar, with the sugar issue, is what can the little guy do? Is there a role for local action? And this is a little case study of a particularly inspiring school that thought that doing something about sugar was a good idea. So as people in New Zealand know, schools have been a battleground for health policy in New Zealand, and when the Labour government enforced rules about selling healthy food in the late 2000s, and then that was repealed a little later by the national government. But despite all the policy changes, one school in Yendarra in the heart of South Auckland, a very poor community, decided to make a positive change. And if you've heard the story of Yendarra, there's been a lot of inspiring talk about what's happened in that through that change in terms of restricting sugary drinks in that school. I'm an epidemiologist, a bean counter of the medical world, and I wanted to know, is there some objective evidence that health has improved in this community through this policy change? So if you hadn't been following the details on this, in 2008 the Labour government said you're only allowed to sell healthy options, healthy food at your school, and the NAG, National Administration Guidelines, quite a good acronym I think, promotes healthy food and nutrition for all students, but selling on the school site, that detail's been removed. So if any of you are around South Auckland, I really encourage you to go and meet Susan, the principal of the school, Susan Dunlop, and see what that school has implemented. They've promoted healthy food. They've been quite strong on restricting sugary drinks since 2006, and they say that the behavioural effects have probably been the most marked. The principal says that before 2006, the line outside her office to deal with in terms of naughty kids was this long. As soon as the ban on sugary drinks was enacted, it went down to this. It's a strong Māori and Pacific school. There's almost no European students. So this is the focus of the intervention. There are all sorts of other things. There was a lot of community engagement, water fountains, fruit and milk were promoted, healthy lunches, drink bottles. Behaviour was modelled. The details of the results were fewer behavioural issues. The dentists noticed, the people selling uniforms noticed, and certainly the teachers noticed. So the study, it's lucky for us that the government provides dental care for kids around New Zealand, so we were able to get the records of these kids and the schools that they attended. So we compared Yendarra students between 2007 to 2014, students aged 8 to 11 years. We wanted the older students who had a chance to be exposed to the school policy, and we collected some information about various other factors that may influence their dental health. The outcome was DMFT, decayed, missing or filled teeth, for you that are not dentists. Basically, as a non-dentist, I just call it total rotten teeth. So the results, we had 4,000 kids, about 500 from Yendarra, about 3,400 from the 9 surrounding schools in this little area of Yendarra, a very socio-economically deprived area. Not a lot of difference in terms of the students comparing the ones from the other schools to Yendarra. You see that about 3/4 of the students were Pacific, and about 20% identified as Māori, very small numbers of other ethnic groups. And this is really the headline, comparing the dental records, fairly high levels of caries in both schools, but we see a clear difference, which is statistically significant, of about 1 tooth per 2 students, an average of 3.5 rotten teeth in other primary schools and 3 rotten teeth in Yendarra. And if we look at the distribution by ethnicity and by age, we see that the most marked differences are in the Pacific and Māori populations, and you see less extreme levels of caries in the Yendarra students. For non-statisticians, this is kind of a way of visualising a regression model where the BDX contribution is really the mean number of decayed teeth, and we see the effect, the various influences or associations in the data comparing ethnic groups. So other ethnic groups have lower levels of caries, about 0.5 or half a rotten tooth less per student. And we see the comparison between Yendarra and all other schools is about half a rotten tooth less. And that's statistically significant. We did some sensitivity analyses and included the younger kids and found much the same result. There's some limitations. Cross-sectional study can't distinguish cause and effect. There could be some selection bias. Health-conscious parents may come into Yendarra, but if you talk about to the student, to the teachers there, they say that it's very unlikely to be the case. Maybe a little bit of selection bias, 20% non-participation, a little bit of measurement error likely with the dental records, but we think that would reduce the size of the benefit. So in summary, this school policy is associated with reduced dental decay on average of 1 tooth per 2 students. 16 decayed teeth per year, we think, are prevented in the Yendarra school. And if we do a little thought experiment and think about what would have happened if we'd taken this policy around all the other schools, 48 decayed teeth per year would have been prevented. And this is something we're trying to push through counties. So we think nutrition policies, particularly in schools and early childcare centres, are very important as a way of improving health, reducing dental caries, obesity and health inequality. So thank you very much.